Hospital-acquired infections present a challenge for all hospitals nationwide. People in hospitals are sick, and so there are environments where you have a concentration of organisms and individuals that, because of their illness, may be somewhat compromised. So you have to have hyper-awareness and controls to make sure that you have good hand hygiene, which is the most effective way of preventing the spread of infections within a hospital. There's a cost factor associated. Hospital-acquired infections may prolong the stay of a patient unnecessarily. There's additional treatment that's required, and the patient's condition can become more complicated. All hospitals have the challenge of hand hygiene, and usually you have a secret shopper, and that always presents its significant barriers and challenges. But I saw this system as pretty foolproof. It just needs to be used. So by having a method that's easy for staff to use, you're going to promote good hand hygiene.
In the old days, we still had hand washing, but there was no way to track it. There was no way to monitor. So with the Proventix, we are able to do that now. So we know who's washing, who's not washing, how often they're washing, and so that helps.
We have a weekly reporting system that comes to us, and our Senior Director of Support Services shares that with the administrative team electronically, and we're able to click on the link and we're able to see results by area and by individual.
I've just seen a lot of improvement on infections from patient to patient. It's helped a lot, I think.
You get to see what it is every month, and you get to see if you're washing in and if you're washing out, because it shows a percentage for washing in and it shows a percentage for washing out, and then it gives you an overall average at the end.
We are a Joint Commission accredited hospital. As a matter of fact, we're also a top tier hospital within Joint Commission, which is an extra level of scrutiny that we go through. But we just had our triennial survey, so every 3 years you are resurveyed by the Joint Commission. We just completed that, and we did exceptionally well.
The Joint Commission was very excited about the Proventix that we were using. They actually described that as a best practice that they will be posting within the Joint Commission website.
Joint Commission has over 1,300 standards that they look at during their 2.5-day survey, and we only had 15 findings. Certainly infection control, patient harm are all very central to the Joint Commission survey process. So the good hand hygiene and the techniques that are used are very much in the spotlight when Joint Commission comes in.
From previous life, it did not have the benefit of Proventix. It was the old scouting reports, secret shoppers, where everybody is compliant when they see you coming around to monitor them.
What most hospitals do, you are depending on secret shoppers or some other type of monitoring process that is not as foolproof as the Proventix system.
But also, if we have a concern of an employee not doing what they're supposed to be doing, such as hourly rounding.
We have had patients before complain saying that a nurse has, they're in pain and a nurse has not checked on them in the last 2 or 3 hours, and we can go back and pull our Proventix and show that the nurse actually had been in the room at least twice every hour and was in the room for more than 2 minutes each time she entered the room. So that we were able to go back and track that and show that that was not the case, and deal with that problem from there.
We believe that customer service is key, because we partner with the customer to ensure that they're getting positive behavioral changes by using our product.
They send us reports weekly, and our representative is always available to answer any questions, do one-on-one phone calls with any new staff or directors. I know that we had a new med-surg director that recently started, and she spent some time with her, teaching her about the system so that she could answer the staff questions.
The Proventix staff has been excellent to work with. Our folk, they're very responsive. They provide good education, good training, and if there's any question, our staff promptly gets the answer from them.
Recommended for other hospitals to use.